Hi, my name is Rob Nassari. I'm with ACO Health Solutions. During this video, we're going to show you how you can leverage our solution to enter data for the Tenet Healthcare Corporation and more importantly your ACO and of course your practice reporting for your quality measures for Blue Cross and Blue Shield. You will receive an email with your username which will allow you to establish your password, and of course once you establish your password we recommend that you bookmark the URL to our solution. It's https://pulse.acohealthsolutions.com. You'll leverage your username or your email address as your username and of course your password to be able to log into the system. The system is very straightforward and very easy to use. The left navigational section of the solution allows you to navigate and go into various screens that you want to be able to enter or move into. The right side displays your data and of course also allows you to do data entry. To be able to provide more data entry or more viewing screen, you can move this separator left or right at any time while you're working the system. You'll see our navigational organizational tree that's on the left-hand side. Tenet Healthcare Solution. Florida, of course, is your ACO name. Practice is your particular practice. And anytime you want to display more of the menu navigational items, you click on the left arrow next to the name that's shown above. In this particular case, our test practice location is called Family Medical of Anytown. To be able to look at your patients, you can either click on any of these screens above or your physicians, or to do simple data entry, we recommend that you click to the arrow next of the quality registry name. At that point, you'll see your payer type, which is Blue Cross and Blue Shield of Texas. If you had an MSSP within your practice, you would also show that listed. To be able to expand and look at the patients within this particular payer program that's been attributed to you, you click on the arrow next to Blue Cross and Blue Shield of Texas and see what the latest attribution file contains. By opening up this attribution file name, you'll see the lowest level within the navigational tree, which has all measures, hemoglobin A1C, and blood pressure. These two separate tables show the data for your patients that apply for this particular measure. The all measures table, which I'll click on here, will show the table for both hemoglobin, blood pressure, or any other quality measures that you're collecting for. By moving the separator across, you get more viewing screen, be able to look at and understand what your patients are and be able to quickly look and find the ones that either need data or have met the measure. If you use this drop-down, you can quickly identify which ones need to be entered, which ones shows an exceptions, or which ones that you've already met. For our test patient, of course, they need data, and there's no reason, of course, to sort or do any other special commands. If you did want to sort on first name or last name, you can quickly type in the first name and hit enter, and it will sort for this patient for Jane Smith, of course. If you ever want to clear any of the sorts that are listed to give you your custom view, click on the clear button on the bottom right-hand side of the table. To be able to enter data, use the hyperlink next to the name under the payer ID, and the hyperlink will be able to bring up the patient profile for Jane Smith. This patient profile section, the summary screen, has two major sections. The patient profile, which has the first name, last name, and all the pertinent information to be able to match and identify if you're entering the data for the right patient. The lower section is called patient exclusions. The exclusion allows you to either identify exclusion that might apply to this particular patient and be able to stop your reporting at any point. If the person died within the program year, moved out of the country, or you weren't able to find the chart, you can be able to go chart not found, add the date that's associated with the time that you've either entered it or what's applied, and add the exclusion. If you need to remove the exclusion, you can, or removing the data that you've entered, you can click quickly onto the remove hyperlink, which removes the information. To enter data for this particular patient, currently you have two quality measures that you have to enter for. Hemoglobin H1C. Now above here is your status that is considered poor control. You'll see that it will change once you enter data for this particular patient. If you don't know the date, of course we advise you or recommend that you put in January 1, 2016. But in this particular situation, we go ahead and ask you to put in the date that's shown within the results and be able to type in the measurement information into this area or use the picker to be able to go up or down by decimals. You can add any comments that might apply into this area and click on the Add button to simply add the measure in here. Now the one thing you'll notice is that the Remove button will show up in the history grid below and the status is changed to A1C is under control. Now if we go back to the summary screen, we go back to the table grid screen for the all measures, the one thing you'll notice for this particular patient is that they've met the measure for hemoglobin A1C, but the blood pressure still needs data. This allows you to quickly identify which ones you still need to account for. By going back into the patient screen or by continuing with your data entry from the original screen, you can click on the blood pressure tab that's located on the left-hand side within the data entry area of the screen. Again, clicking on the date from the date picker or typing in the date directly into the box will allow you to establish the date, place the information in here, again, either by using the clicker or by entering directly into the box. You can use the documented follow-up measures as applied, or you can leave it blank. And again, no blood pressure has been taken within the measurement period, but by adding this blood pressure reading, this will change the status and will show that it's met, and you're completely done with data entry for this patient. At this point, you can log off or go back and work the next patient on the list by quickly clicking on the All Measure screen and finding the next patient that's listed. I hope you enjoy your experience by entering data in the system. If you have any questions or concerns, feel free to contact us via email at support@acohealthsolutions.com or contact your system administrator. Thank you.